Hi, my name is Sarita.
And my name is Rena.
We are both past patients with Mexico Bariatric Center, and we are here to break the stigma of having weight loss surgery in Tijuana, Mexico. We will be covering all things bariatric to help you get the most out of this weight loss journey.
Hi, friends!
Hello, friends.
Welcome to Can You Stomach This? On today's episode, what are we going to talk about today?
We will be talking about some different surgeries.
Yes.
Balloon, gastric balloon, the endoscopic sleeve.
Yes.
The mini sleeve, the vertical gastric sleeve,
Yes.
and the single incision sleeve, also known as SILS.
Right.
Can you stomach this?
Can you stomach this?
Well, I did have one of these surgeries, so yes.
I think I could stomach
We
this.
both had one.
We did. We did have the sleeve, actually.
Right.
Yeah.
So,
can you stomach this?
yes.
Yes.
I am stomaching this.
And you can stomach it too. So,
Right.
let's dive right into this. So, what is
So I think the first question is, a lot of patients wonder, which is the best surgery?
Right.
And what surgery options do you have?
Right, because
Or
that's
do I
important.
have?
It's
Yeah.
important to know what's out there,
Right,
to
and be
know what your
informed.
options are,
Right.
to be informed.
Mhm.
It is important to be informed.
Right.
So let's help with that. Let's help with some
Right.
information
Right.
here.
So the first one that we're going to talk about is the gastric balloon.
Yes. Yes. So the gastric balloon is an endoscopic procedure. It is inserted. So it's an object inserted into your stomach endoscopically. It is inflated, and so this inflated balloon creates restriction by giving you the full feeling of fullness. And so it also, by doing that, it also makes overeating uncomfortable.
Yes.
And so that's how it works.
Okay. And tell us, what are the pros and cons of the gastric balloon?
So let's just be honest. The pros of this surgery is that it's endoscopic. So if a laparoscopic procedure is not something that you can do, a balloon would be a pro. It does help some people with weight loss. I suppose that's a pro. I like to say, you can call this a pro or a con. I'm not sure, but I like to call this an event surgery. And
what is an event surgery?
Right. What is an event surgery?
Yeah.
So I like to describe gastric balloon as a great tool for losing. Let's say you have a wedding coming up, right? And you want to be a beautiful bride in your wedding dress, and so you want to lose like 20 pounds to get into your wedding dress, and you don't care if you gain that weight back, right, after the wedding.
I personally would, but
I know, but some people
don't. Yeah.
Okay, so in that case, the balloon might be a good option for you. And why do I say that? Why do I call it event surgery? Because weight regain once the balloon is removed is very the chances of that are very high.
High possibility.
Yes, and so let's go more into that's a con. And so a con also is that it causes discomfort. It's designed to cause discomfort, but no stomach is the same size, but all the balloons are the same size. So if you already have a smaller stomach, the balloon's going to put so much pressure on your stomach that it pushes against it, and it's too uncomfortable for you.
Absolutely.
And as you've seen, we've had many patients have them put in, and they want them out immediately.
Yeah, like immediately, like that day.
Yes. Now that's not to say that it's not a good surgery for some people. If if your stomach is already kind of larger, the balloon goes in. It does exactly what it's supposed to do, and it can help you lose a little weight. When you remove that balloon, your stomach is still larger. Therefore, you feel really hungry.
Right.
And we do have a coordinator who has had the balloon and then had the complications with it. You are putting a foreign object in your body.
Yes.
At the end of the day, and then so most people who get a balloon, they end up coming back to have a sleeve.
Right. They come back. They gain the weight back. They come back for a sleeve.
Yes. So it's not a terrible procedure, but it's
not for everybody.
It's not for everybody. It's actually designed for a very small audience of people, I guess.
Yeah,
a small
I would
group
say
of people.
Small group of patients.
It's very small. So that's kind of the gist on the balloon.
Yeah. The next surgery or procedure that we will talk about is the endoscopic gastric sleeve.
ESG.
ESG, yes.
Yes,
ESG.
yes. Endo sleeve. People call it the endo sleeve.
Right, endo sleeve.
Right. So let's talk about that. So it's also endoscopic. I've had patients who, for example, didn't believe in having surgery.
Right.
That worked for them. So it's endoscopic, and what it does is it sews the stomach smaller instead of actually cutting it off. You can't sew it as small as you can cut it, so you're not getting like that full removal.
Kind of like isn't it kind of like folding it over and sewing it? Kind of. Is that a good way to explain it?
I think it kind of pulls it in.
Oh, okay.
Definitely look at the website because you can kind of see it. But the thing about the endo sleeve is because you can't remove the larger portion of the stomach and you're only sewing it and pulling it in, you still have the hunger hormone, and you can't sew it as small. So you still have that hunger producing hormone that comes from the stomach lining, and then you also still have you're not feeling as much restriction. Right.
So what are the pros and cons of the endo sleeve?
Yes. So pro, like I said, it's endo. It's endoscopic. Endoscopic means it goes down, the procedure's done through your throat. There's no actual surgery. It's a procedure.
Right.
And the thing about the endoscopic sleeve is, like I mentioned, if maybe you have a belief system that says you can't have an elective surgery, only surgery in life or death, or what if you have had like a abdominal trauma and you have lots of scarring and you can't.
Possible.
Yeah, and it's not possible to go in. If there's some reason you can't have a laparoscopic procedure, an endoscopic sleeve is better than no sleeve. In some cases. And so that would be kind of the pros of it. Really, it's a new procedure in the world. It's only been around for a very short amount of time. Our Dr. Rodriguez is the only surgeon that does them. And
he just started a few months ago, right?
Oh no, he's done them over a year. About a year and a half, I think. But the thing about the surgery is just in the world, statistically overall, it's just not reporting back with some good statistics. So that brings me to the cons. The cons are that you feel little to no restriction, and that's because of how I mentioned with it being sewn. Also, little weight loss. You have a lot less weight loss than you would with the standard sleeve, and that's because of not creating that restriction, and then also that hunger hormone part not getting removed. And so, also with endo sleeve, there's a higher chance of weight regain. Also because of the same reasons. So that's kind of the gist of the endo sleeve. It's unless you just have a really good reason you can't have a laparoscopic procedure, it's not really recommended. Right. Also appeals to a very small group of people.
Yes. So next procedure is called the mini sleeve.
Yes. Also one that has... So let's talk about what it is, and then we'll talk about it. So mini sleeve is technically the gastric sleeve on a smaller scale, meaning that it is done laparoscopically, like the gastric sleeve, but it removes 50% of the stomach instead of the 80 to 85%. Right, so you remove a lesser portion. And so...
what are the pros and cons of the mini sleeve?
Well, so the pros would be it's laparoscopic. I don't know if you'd call that a pro, but it is a laparoscopic procedure. It would be also a pro for that would be if there was a reason that you can't have a VSG, like a full sleeve. I don't know really what the health condition would be, but like let's say you have a health condition or something that would prevent you from really going with a full sleeve.
It's just another option.
Yeah, it's another option, and some weight loss is better than no weight loss. But the thing about it, and we'll talk about the cons, is that also again very little restriction is felt because you're not really removing a lot of the stomach. There is actually little to no weight loss with this procedure.
You're paying the same amount of money.
Yes.
you're having less of your stomach removed,
Right.
and the weight loss is much lower.
It is,
if any.
it's half,
Yeah.
technically. If
Yeah,
any
half.
at all, it would be up to half.
Mhm.
So, like, what we could say is, it's good for, so gastric sleeve is good for approximately 65% of excess fat, but then
Right.
mini sleeve is only good for about 30%.
So if you were a patient and we get this question a lot, if you have a lower BMI, is this a good option for you?
It's not, actually. And that is a huge misconception, because people think, well, I'm smaller, I can't afford, I don't have 100 pounds to lose. Maybe your BMI is lower. In that case, absolutely not. The mini sleeve is not a good option for you, because let's say that your excess fat is only 30 pounds.
That's
right?
not much.
Well,
Yeah.
okay, so like 65% of 30 pounds is what, just short of 20 pounds?
It's just under 20 pounds.
All right, so if you had a standard sleeve, in that case, you would approximately, and of course these are
20.
statistics.
Right.
So statistically, you would lose approximately just short of 20 pounds.
Right. 19 pounds.
Yeah. And so if you had mini sleeve, which is the same price, they do it the same way.
Right.
You're going through all the same things. You might lose half that. So
Right.
you would be paying all that money and putting yourself through that to lose
less than 10 pounds.
less than 10 pounds, if you even lost 10 pounds.
Right. You might not lose anything.
And so people say, well, if it's not a good surgery, why does it exist? Well, to be honest with you, the higher your BMI, the more effective a mini sleeve would be. Because your BMI is higher, and 30% of 100 is 30.
Right.
So you would lose approximately 30 pounds if your excess fat was higher. So it's just not a good procedure for a lower BMI
Right.
person at all.
Right. And our next is surgery that we have both had.
Yes.
The VSG, vertical sleeve gastrectomy.
Yes.
The
The sleeve.
sleeve.
Yes.
It's the golden standard for bariatric surgery.
It really is.
It's the most approved surgery.
Mm-hmm.
It removes 80 to 85% of your stomach.
It does.
Yeah.
And by removing 80 to 85% of your stomach, you have removed the portion of the stomach where the hunger hormone comes from.
Right.
So you've created restriction. You're not feeling that hunger.
Right.
It takes 3 to 5 incisions.
I had 4.
I had 5, and I've seen people that have only had 3.
Yeah.
So it is 3 to 5 incisions. You do lose approximately, so statistically they say 60 to 70%. I just always say approximately 65.
I lost 100%.
Yes. She definitely lost all of her excess
I
fat.
did.
I lost exactly 65%.
Oh.
Exactly.
I did not know that.
I did. I lost exactly 65% with that gastric sleeve, and I hit a wall. And that's why I did my revision. Because I hit a wall, and it didn't matter what I did for a whole year, I couldn't lose another pound.
Right.
Yeah.
Makes sense.
Yeah. So, but
Statistically.
statistics, right?
Right.
I think you mentioned it is the most approved.
Mm-hmm.
And so I wanted to say that it is typically approved regardless of BMI.
Mm-hmm.
I've seen people approved for gastric sleeve anywhere from a BMI of like 26 to BMIs of like 100.
Right. We've had high BMIs like that.
Yes. And so and you would say, well, why wouldn't somebody with a BMI have like a more aggressive surgery? Well, it's a great starter surgery for higher BMIs.
Yes.
Like I mentioned, I had sleeve. I lost that 65%, and I needed the revision to go forward, but you lost all of the weight that you needed.
I did.
And so it would have been, you started at a BMI that would have been appropriate to have a more aggressive surgery. What was your BMI?
I think it was 36. 36.
Okay.
Yeah.
So see, in your case, had you not have exceeded that, you could have had revision, but you didn't need one.
I didn't need one. I don't want one.
Right.
I don't want one at all.
You work very hard not to get yourself in some place.
And next month I will be 6 years post-op.
You will.
For my VSG. Yeah.
I know. I'm so excited for you.
Me too.
And you're killing it still.
Thank you.
To this day. And so it worked for you. And so a lot of times we would say, just you could have the sleeve first. If it doesn't work for you, then, you know, have a revision and you can lose more. Also, if your BMI is really high, oftentimes surgeons will recommend that you have a sleeve first because weight loss surgery equals rapid weight loss, which can potentially wreak havoc on our bodies. Our hormones kind of go crazy.
Yes.
We're losing all this weight. It affects our joints to lose weight really quickly. But don't let that discourage you.
No.
Because your body can handle it. But when your BMI is really high and you have a more aggressive surgery, you're going to lose more weight even faster, and it's healthier sometimes to lose it in stages.
Right.
So like, in fact, I believe it's Dr. Valenzuela. She will not approve higher BMIs for a more aggressive surgery because it's healthier for the body to lose it in stages.
Right.
I believe that's her.
And that's how they used to do a duodenal switch. They did the sleeve first.
And then you had to wait like a year.
Right, and then you would have the DS. So, I mean, it does make sense.
It does. And it works, right?
Yeah. It works.
It does work. 215 pounds later, it works. Yes. 150 pounds.
It's still a work in progress.
I know, I'm still losing.
Right.
Yes.
So there you go.
So also, there's no long-term effects really with the sleeve. People always say, what are the long-term effects? I assure you that your excess fat, obesity has way more long-term effects on your body than this surgery.
Yes, I agree.
And so people say, well, what about malnutrition? What about, you don't have any of that with gastric sleeve. You do want to take vitamins for the first year, but you don't, or 2 years.
Yeah,
we recommend
I see 2 years,
but you don't create malabsorption. You're not bypassing intestine like with the bypasses. But you're just reducing the size of your stomach. Life is so normal post gastric sleeve. It's not magic. I tell everybody it's not magic. All of the surgeries are a tool.
Yes.
And so it is a tool to help you see fruits of your labor. So if you're eating right and you're exercising and you can't lose weight, gastric sleeve is going to let you see the fruits of that labor.
Right.
Don't you think?
I'm proof of that.
I know.
I am.
You really are. So,
and it's okay to lose slow. I have to add that.
It is okay. It is okay.
Yeah.
For sure. And so with gastric sleeve, there's actually, if you have a lower BMI, there is the single incision.
Yes, single incision laparoscopic surgery, also known as SILS, SILS.
The SILS.
Same as the vertical sleeve gastrectomy, only 2 incisions, one in your navel and your drain.
I know, but you said single incision. You know that name is a little misleading.
You have to have a drain.
You do. And so if you are one of those people with a lower BMI and you wanted an endoscopic procedure because maybe you want to wear a bikini later and you don't want people to see your scars.
Right.
The SILS is your choice.
Right.
That's your option. I would say that's your go-to. Now, SILS is approximately $1,000 more.
Yes, it does cost more.
It's a more tedious procedure. It is done through the navel. And so I like to explain that drain. It's usually lateral to the navel. People always say, where is it? It's usually lateral to the navel. And then
on point.
And so the thing about it is, I explain it like this. So your drain scar, and you can vouch for this. If you take your thumbnail or your pinky nail, your pinky nail, and you poke it into your skin, and the impression that it leaves, that's pretty much what you're looking at for a drain incision.
It's very tiny.
It's so tiny. I can't even see mine. And I've had 2 in the same spot.
Mine are like little dots.
They are. They're
I don't even know where
tiny.
they're at. They're so
right?
tiny. Yeah.
They're so little. So don't let that little drain incision discourage you. Honestly, I would say they probably look like a very small chicken pox scar for most people.
A dot.
Yeah, a dot.
A dot.
If you see it at all.
I wore a bikini last year.
Oh, in public?
In public.
Did that feel good?
It was very freeing.
Oh,
I hadn't worn one in 25 years, maybe.
Yay!
And I'll be 60 this year, so yeah, that was awesome. Yeah,
that is awesome. Yeah. I'm so happy for you.
It's very freeing.
I don't think I'll ever wear a bikini in public.
Yeah, I was at
I'm okay with that though.
Disney World.
Okay.
I was at Disney World.
Let your magic shine.
Yeah, it was my magic.
Let your magic shine. So, and then back to the single incision, though. It is for lower BMIs. Typically, they won't approve you over about 35. So if your BMI is over 35 and you really want a single incision, talk to your coordinator. You can request it from the surgeon. I would say ask Dr. Osuna. But anyway, but it is great for less scarring if that's something you're looking for. Now, if you read about it, statistically, it does say that the single incision is less invasive or heals faster, or has less. It says has less complications. That's the word I was looking for. It says that it has less complications, and I want to explain that in that you have less incisions that need to heal,
Right.
and so really that complication rate kind of comes from like the incisions. Not that incisions healing are a problem, but this surgery is for lower BMI people. Lower BMI people don't have as much fat to heal through. Therefore, the incisions typically heal faster. Anyway. So that's kind of why people ask me all the time, well, it says single incision it has less complications. That's really what that is.
Yeah. Good explanation.
Yeah. And so either way, no matter what surgery you have in mind, you can always talk to your coordinator. You can always call, text, email us. We'll be glad to help you. If you want to hear about it from we have a surgeon liaison. You can always also reach out to her.
Our website.
And there is a ton of information on our website.
There's a ton of information.
A ton of information on our website.
Pictures and diagrams and lots of detail.
Yes, I love the one that shows all the surgeries side by side, so you can compare, like the statistics and what it is and what it does.
Be informed.
Be informed for sure. And so, anything else we want to talk about with these surgeries?
I don't think so.
Listen, sleeve is really the way to go. I mean, unless there's like a really good reason why you need another one. Single incision for lower BMI or a gastric sleeve for literally anybody is a really good choice. Golden standard. Yay!
This concludes our podcast.
Does it have to? I don't want to leave. Do you want to leave? I guess we
will do another one.
We will. As a matter of fact, tune in to the bypass episode. We're going to talk about bypasses.
Yeah, so
sure.
We hope this helps.
Yes.
We hope this helps you make an informed decision about which surgery is best for you.
Absolutely.
Feel free to call, text, or email
anytime. You can drop a comment if you're on the YouTube or the Facebook. Drop us a comment.
And thank you for tuning in.
Yes, it was good to see you guys.
Bye, friends.
Bye, friends. If you have any questions or want to share your bariatric weight loss journey, you can call or text us at 480-999-4826 or send an email to podcast@mexicobariatriccenter.com. You can also follow Mexico Bariatric Center on Facebook, Instagram, and Twitter. Keep in mind, these are the opinions of the host. The views represented do not reflect or define the values of Mexico Bariatric Center. This podcast is sponsored by Emerge Bariatrics and Mexico Bariatric Center. Please visit mexicobariatriccenter.com for more information.